Hi. Hi, I'm Rabbi Gadi Levy, and I'm here to answer your questions, excuse me, about circumcision. So one of the questions that I commonly get is, he's fussy after the circumcision. Is this normal? So usually with regards to circumcision, a baby is going to be a bit fussy after the circumcision. Usually they'll be fussy to a maximum of 6 to 12 hours after the circumcision. Should not be much longer. Some babies will have a bit of a change with regards to their feeding schedule and especially their sleeping schedule. But I usually tell parents, give yourselves 24 hours before being concerned about his fussiness. So that's question number one. Question number two, when can I start bathing my baby after the circumcision? I usually encourage parents to bathe their baby after circumcision, but I tell them to wait 48 hours. The advantage of bathing a baby is it helps with regards to the healing. The water washes away any cream or any dirt that may be in the area. It helps enable the body to restart the healing process. So I encourage parents to give him a daily bath starting 48 hours after the baby's circumcision. Question number three, I see something red in his diaper. Should I be concerned? So that is a open-ended question. What does it mean red? And what does it mean in his diaper? So straight after the circumcision, there's typically a little bit of blood in the area. And when the baby urinates, he'll wash that blood out into the diaper, and one may see a little bit of red in the diaper, sometimes a little bit of orange. What's really happening is that the body is just washing that area out. When the area that we are concerned about is with regards to seeing excessive blood. And what I mean by that is liquid dripping in that area. That is something to be extremely concerned about, and one should ensure that one gets that taken care of as soon as possible by going to the ER or having a professional doctor stop the bleeding. Question number three, will it look normal? And the answer to that is absolutely. If you got your son's circumcision done by a professional, you should not need to worry about what it's going to look like afterwards. The penis just needs a bit of time to heal, and it will look normal. And what I'm talking about is with regards to time, I'm asking about 8 to 10 days up to 2 weeks. By the end of 2 weeks, it should look pretty normal. Now, there are issues that do come up with regards to complication. The most common issue with regards to complication is adhesion, where you have the head of the penis and there is a ridge around the head. And sometimes what happens is some of that skin will become adhesed to the head of the penis, and one wants to make sure that one separates that. That is the most common issue, and that is commonly found when parents are worried that they say it doesn't look normal. It's usually what happened is some of the foreskin covered came up over the head and is getting adhesed to the head, and one needs to dislodge that. Usually one is able to initially able to push it down by using one's four fingers, and just gently push down over that area and dislodge the foreskin. When should I be concerned? Okay, so that's a great question. When should I be concerned? So you want to be concerned when you see things that are not normal. And there are two main issues with regards to the actual penis, or as we said, excessive bleeding. And excessive bleeding means early on, meaning during the first 6 to 12 hours. If one has excessive bleeding, that's the only time that you would have an issue with excessive bleeding that needs to be taken care of by a professional. Immediately get the baby to a ER room or to a doctor. The next issue can be infection. Infection is very unlikely and very uncommon, but there are families where it does happen. And infection means that the area can get swollen, and swollen is a difficult area to talk about because during the first 48 hours, it will be significantly swollen. But if we're talking about 3 or 4 or 5 days later, it's looking worse and worse. That is most likely an infection, and one needs to get that taken care of. And then lastly, the baby having a fever. If the baby's having a fever, that may be a negative reaction towards the circumcision, and one should also seek medical help. Those are really the 3 most common issues that I come across with regards to circumcision. Feel free to send me if any other questions that you may have. I look forward to being in touch with you and speaking soon. Have a wonderful day.